This is Pebbles, and she has a shoulder problem. Which shoulder is it?
My right shoulder.
The right shoulder, okay. So of course I'm on the wrong side. We're going to go through a quick exam for the shoulder. So first we're going to have you bring your arm up this way. Is there any pain with that?
No, it just feels stiff like back here.
All right, a little soreness, stiffness in the back of the shoulder right there. And if we bring it back this way, any pain?
Not really, no.
Okay. Any pain with that?
It just feels like this tingling.
That same spot there? Okay.
And it just feels stiff in that same spot.
That same spot again. All right, and all of it is right about here, right?
Yeah.
All right, so she has a problem with the infraspinatus or teres muscle on the back side of her shoulder, these are two of the rotator cuff muscles. 2 years, that's a long time. You should have been here about a year and 11 months ago.
Yeah.
Now, we know this muscle is tight, but we have to also check the front, because sometimes what will happen is that with all of the heavy lifting that you're doing, you're getting the muscles in the front of the chest, and the bicep muscle here is going to get stronger, and your shoulder starts to roll forward like this. And this muscle is struggling to pull your shoulder back where it's supposed to be. It's the front that's causing the problem. Not in all cases, but a lot of times that's what I'm finding. So what we want is the shoulder to be back in this position. And do you feel that, how that takes that tension off the muscle back here? So we need to stretch there, okay? And then we're going to do some work on this as well.
Okay.
All right. So the first stretch you're going to do, we're going to stretch the pectoralis muscle here. Turn away from the arm and lean forward, and you're going to feel a really nice stretch right through there. Yep, reach high. There you go, like that. Lean forward, turn a little bit. Feel that stretch?
Yep.
It kind of hurts, doesn't it?
Yeah, it does.
But it feels kind of good at the same time. All right? Relax, bring your arm down, kind of shake it loose a little bit.
Oh, okay.
Feel different?
Yeah, it does.
And then bring it back up there and do that again. We're going to bring them straight back and pull those muscles in that bicep. You feel that? Okay. And we hold that again for about 10 to 15 seconds. You want to do that about 3 or 4 times. So you're going to shake them loose a little bit. And then you repeat that. How does that feel?
Better. You can really feel it in this arm that last time.
Yeah.
Just repeat
And you
that
just go
motion.
back and forth.
Okay.
Yeah? You go back and forth like that.
And then I just roll.
Roll. There you go. Very good. Now you should feel that pulling right through here. And it, you know that when you do any exercise, any stretch like that, you do it till it becomes uncomfortable, and then you stop.
Okay.
And you know, with the door stretch, that your arm was being pulled back, and you were going, "Oh, that's hurting."
Yeah.
That's when you stop.
Okay.
Okay. You don't want to hurt it. You want to just stretch it.
Okay.
So don't overdo it.
All right.
Okay. Now, normally what we would also do is have her lay on the table, and we would do an adjustment. And we would also use this tool. I'm going to have you come right over here. We're also going to work on the back of the shoulder here. We're going to do a little bit of muscle work to loosen this up. How does that feel? Some tender spots there, isn't there? And then we're going to use it on the bicep here a little bit as well. Now, like I said, we would have her lay on the table, we would do a couple of adjustments to the shoulder and get this into a better position. And that's going to help relieve some of the pressure and tension in the shoulder as well.